This conference will now be recorded.
Well, good morning, everyone. My name's Bob Lane. I don't know that I've had a chance to meet any of you all. Certainly, this is the second time because of this pandemic that we've had to do this essentially completely virtual. Not the most ideal circumstances, but I'm sure we can all make the best of it. Little bit about me. I work for BKD. We're a CPA and advisory firm. I am, by background, an administrator. I continue to hold license, and I've got a little bit of a perspective dating all the way back to 1987, which is when I first began practicing. Today, it's just you all and me. We're going to be covering several different topics over the course of the day, and as he mentioned, we'll be breaking in between each one of these presentations. I want you to feel free to ask questions throughout the course of each presentation. I've got the chat box up and running, so as questions or comments come in, I will certainly try and respond to them. The way that our day is going to go today is first of all, we're going to kind of talk a little bit about comparing and controlling quality. One of the things that that I see as an operations consultant out in the field, working with providers all over the country, is the still, even after a few years of this, a real lack of application, and maybe that's born from a lack of understanding of true quality improvement principles. Everyone obviously should be up and running with their QAPI programs, but what I see is that many times a QAPI program is being called QAPI even though they're just still doing just quality assurance. So we're going to be talking a little bit about some of those differences over the course of this presentation. After that, we're going to dive into a topic that will probably take us all the way to lunch, and that is the talking a little bit about Medicare. And of course, there are some nuances that are currently in place that we'll make mention of in relationship to waivers and things of that nature. But we're going to be talking about the Medicare program in terms of the traditional payment program. And we can talk a little bit about how the differences may apply to things like managed care and things of that nature. PDPM, all of that. And then this afternoon, we will of course be talking a little bit about a topic that is something that we need to probably give a little bit more emphasis to, cognizant of, and that is generational differences. We've got a wide diversity of generations that are now in the workplace, and that sometimes can either be a strength or it can be a source of great frustration for you in your role as an administrator or aspiring administrator. So we want to talk a little bit about that. And then last is something that's near and dear to my heart and is a passion of mine, and that's leadership. And that's something that we will go into a little bit of in-depth discussion about, and I'll provide some recommendations in terms of some good resources as you all move throughout the rest of this course and into your role as an AIT and ultimately into as an administrator in a community, whether it be skilled nursing or assisted living. So as I said, I've been around since 1987. I've run both skilled nursing and assisted living buildings. I also helped ramp up the original scope of work for CMS with the QIO program back in 2006, 7, that sort of thing. Actually all the way back to 2003. And so a little bit of perspective on that. So we'll start with comparing and controlling quality. And again, as I said, feel free to jump in with questions or comments as we go along in the chat box. As I said, our objectives, certainly understanding the differences between just quality assurance or QA and quality improvement. There are some significant differences, and a lot of it has to do with organizational mindset. Quality assurance is really more of kind of a compliance deal. It's certainly written right into the interpretive guidelines. It is federal law. QAPI or quality improvement, although QAPI is a requirement, quality improvement and that mindset is vastly different because it's a mindset of we have to understand we're never going to actually reach our final destination. We've got to continue to strive. Where there's always an opportunity to continue to improve, and understanding how and when to apply those quality principles within your organization is part of your role as an administrator and a leader. And understand what your role is in the overall quality agenda for your organization. What are some various tools that you may or may not be aware are at your disposal to help lead your program and your community to in a mindset of continuous quality improvement. A little bit of acronyms here. QA, as I said, is regulated as part of federal requirements. You're required to have a quality assurance committee, and many times buildings, you usually do that around the whole premise of a either a breakfast, lunch, or dinner. Obviously, back in the day, there was a utilization review component, and so you had to have a physician involved. Most of your buildings probably still involve your medical director, as you should, to help look at the overall service delivery within your organization. Many times it is clinical in nature, but there's so many other things that are encompassed that should be encompassed within the quality program, and that's where your role as a leader is to make sure that all of those things are included. QI, as I said, is more or less voluntary. The state and CMS expect you to use a QI approach as you address deficiencies. Once you receive that statement of deficiencies, the 2567, they expect you to incorporate a QI mindset into your plan of correction. There are questions that are required to be addressed within your POC that many times when I'm reviewing 2567s for clients, don't necessarily see all of those questions adequately addressed. Moreover, I don't see them, even if they are addressed, I don't see those flow over into things such as your facility assessment, your QAPI program, and certainly within your ongoing in-service education for your staff. Also, as an acronym, as you can see, it also might be called CQI, continuous quality improvement, total quality management, which many of you may have associate with W. Edwards Deming back in the 1940s and 50s. So it's a lot of different acronyms, but at the end of the day, in its foundation, it's all about the same thing, and that's quality improvement. So a couple of different areas, what I call the quality trilogy, and one is quality planning, and that is, okay, we know we want to aspire to be better, but how do we go about doing that? And so that involves you just can't, off the cuff, knee-jerk reaction, decide, okay, we're going to do QI types of activities. We need to plan for those appropriately, prioritize. Quality control is more of the mechanics if you will, of how to go about doing quality improvement. And then quality improvement itself is more, as I said, is more of a mindset. It's about changing your organization's culture to never be satisfied. We need to always be continuing to try and be better. Quality planning, of course, as I said, is all about planning. So what we need to do is be able to identify our customers who are, can be both internal and external. And I don't know about you all, but throughout my career, I've come to embrace the fact that we are customers of each other. The definition of a customer is anyone who comes in contact with your particular services. And so as an individual, it might be your coworkers, certainly the elders that you're caring for within your building, those families that are, hopefully slowly coming back in, being able to visit their loved ones again. But it also can be departments. For instance, that ages-old, conflict that sometimes exists between nursing and dietary, or nursing and rehab, or nursing and activities. Always seems to be, of course, nursing's the largest department, and so it's always, there's these friction that can sometimes come up between departments, and so adopting a more of a customer-friendly approach and understanding that we're customers of each other can help you get past some of that friction and get you both on the same page. So understanding what your customers' needs are. So how do you go about doing that? Well, determining customer needs can be something just as simple as, the informal. So how can I serve you better? So it's just the simple ask. Can also go all the way to the standpoint of, formal surveys. And there are more and more software programs out there that are being utilized to collect that data and to analyze it so that you can make better decisions. And so understanding what your customers' needs are, and then based on those needs, being able to prioritize and set goals that will help move you in that direction. Okay, so setting goals that meet the needs of the customers. And then goals in and of themselves are great, but you have to also have processes. And those systems are built of processes that form the building blocks of a systems change that will help you to achieve the improvement that you're looking for, or those desired results that you are aspiring to. And that can be anything from clinical care to customer satisfaction to food quality. That could be in terms of response time. That could be, whatever. There are any number of different things. Quality control. Again, as I said earlier, this is some more of the mechanics, if you will, the nuts and bolts of your program. And so understanding, once you've got a plan in place, understanding what your customers' needs are, understanding who your customers are, and kind of have that overall framework, now we get into the nuts and bolts of how do we go about moving in that direction towards those goals. So first of all, choosing what to control. What is it that is, is it controllable? What's the unit of measurement that we're going to utilize in which to understand whether we're making progress or not? Establishing a measurement. Are we going to measure this? Are we going to look at this on a weekly basis, a daily basis, monthly basis? That's all part of understanding, and you should have varying priorities. Some things are more, of course, urgent and require more regular review. There are other things that may need to be looked at, but maybe not as often. So maybe something semi-annually. For example, your facility assessment. You're required to at least look at it annually, but a lot of the organizations that I talk to in the across the country are actually looking at it more semi-annually, because things, especially right now, as we all know, are so volatile and ever changing as new guidance and new challenges come about because of this pandemic. Standards of performance. What is the standard? What is it that is the expectation? And so a standard of performance might be, and I would comment on this and say, if there's any one little nugget that you come out of this presentation from, it's that state regulations or federal regulations are the minimum standard. Okay, so what we're looking for is the regs actually are the expectation at a minimum. And many providers aspire to just get there. And the problem is if you just get there, then there's so much more opportunity to improve, but we kind of fall flat after that because we hit the minimum. And that's not indicative of a culture of continuous improvement. Other standards of performance might be measuring against yourself, benchmarking against yourself, or against maybe if you're in a multi-facility organization, maybe benchmarking off of a higher performing building. Measuring actual performance, where are we against where we say we want to be? Okay, so that's the performance gap. Where are we versus where we aspire to be? And then whatever that gap is, interpreting the difference. So what does that mean to your organization? Obviously, if we're not in compliance, we're not meeting that minimum regulatory standard, then obviously there are things that need to be addressed. And so you have to take action on those differences. Okay, so what you see happening here in quality control is the nuts and bolts of moving in that direction of quality improvement, but it's not quality improvement in and of itself. QI is you actually have to prove the need. So not everything can be improved. Not everything should necessarily be improved, at least all at the same time. You're going to run yourself ragged and your organization if you're trying to improve everything. So you've got to prioritize, and you've got to utilize information and data to understand where your priorities should lie. I just finished doing some operational assessments for a client in another state, and what I saw is that they had these issues from a clinical service delivery that they said that they were going to be addressing within their plan of correction, but nowhere in their in-service calendars did I see any education going on relative to changes or improvements that they needed to make in terms of care delivery. And so they were just giving lip service simply to what they thought was going to help them to get their POC cleared. Problem is if they don't address those deficient practices, then they're going to end up getting those citations again, and then that can spiral down into other issues. So identifying specific project or areas for improvement, and that comes to, as I said, prioritizing, what's the things that we need to be addressing on a high level, and then from there, it's the need to do's versus the nice to do's. And so organizing to guide those projects. Okay, so we're moving in a direction where, as you can hopefully see, we're looking at setting up our QAPI program. So organizing to guide those projects, understanding what it is that we need to focus on, and then start digging in terms of diagnosis to find the causes. That's root cause analysis. That's understanding that there's something at the root at the heart of any deficient area or area that you want to improve, there is a root cause. And W. Edwards Deming, in in his total quality management approach, basically said that about 90% of the causes of underperformance are problems related to the system or the process and not the people. Unfortunately, many organizations that I encounter seem to think that, oh, it's so and so's fault because we didn't have enough staff, or they were underperforming as a person, or not to say that people don't have a contributing uh, piece of the puzzle, but it's usually the system or the process that they are trying to follow that is deficient, that causes them to underperform. So once you understand what the root cause is, then you can determine what kind of systems changes or remedies that you can put into place, or test, if you will. And I don't know if you've had an opportunity to hear from John Leone or someone from the OFMQ or the QIO from TMF or Telegen or whoever's doing the QI piece in AU this time. But it's about PDSA cycles, rapid PDSAs, testing systems changes before you adopt them facility-wide. You might find that a PDSA, a systems change works great for this particular cohort of patients or this particular wing or this particular, but once you start spreading it, you may have to evolve how you go about changing because it might not work as it worked for that smaller group. So again, proving those remedies that are effective in application, depending on how, as you spread it to a wider aspect of your organization. And then once you are hitting on most of all of your cylinders, once you get where you would like to be and have a comfort range, how do you stay there? How do you hold those gains as you continue to try and improve going forward? You don't want to have that one step forward, two step back type of approach, because you're never really going to make progress that way. So being able to hold your gains while you continue to improve will continue to move you forward. So in the long-term care context, in the post-acute world that we live in, there's a lot of different areas that quality applies. And of course, as I've made reference to, regulatory driven is usually where, the first thing that we think of when we start. And that is, survey performance, and certainly not stopping there. We've got other regulatory compliance aspects. We've got OSHA, we've got Department of Labor, Equal Employment Opportunity Commission. We've got all these various alphabet agencies that are looking at us. And so we've got compliance aspects associated with all of those things. And so again, what kind of systems do we have in place to assure that we are in compliance and continuing to improve from the regulatory standpoint? We also have reimbursement, payment. Certainly, Medicare is, and we'll talk more about that in a different section today, but, utilizing quality improvement principles to improve your Medicare management. And as we get into Medicare and start talking a little bit about PDPM, there's a tremendous amount of opportunity to, look at all these various components of PDPM and, how you can apply a QI mindset to improve both the outcome for the patient that's receiving services, and at the same time, optimize the opportunity for you to be paid based on the services that you're delivering. In Medicaid and more states, in fact, right now, I don't know if many of you are aware of this, but there's been a recent development to where there is going to be another attempt to move in the direction of privatizing Medicaid here in the state of Oklahoma, which would basically make Medicaid a managed care type of plan. In the past, that has fallen. It's died at the steps of the Capitol. There's always this temptation for state Medicaid agencies. They're so tempted by the cost savings and all of that, but regardless, we'll see where that goes. But in the meantime, you've got certainly we've got the focus on excellence, or the performance improvement program that pays you additional dollars per Medicaid day based on your performance in 4 quality measures. And so having the opportunity to achieve those additional dollars in those 4 clinical areas, well, there's obviously systems that go into improving your care delivery and the outcomes that you achieve. And so certainly QI is something that can be applied in that environment. Okay, so that moves us to QAPI. And so QAPI, of course, stands for Quality Assurance Performance Improvement. And a little bit of history: it was enacted as part of the Affordable Care Act. And in its enactment, provides for accountability requirements for facilities within, it's housed underneath the tag for quality assurance. And so what happens, of course, is, and QAPI has been around, it's been around, in our environment for a few years now, but it was in existence for hospitals, home health agencies, and other providers for even longer than that. So QAPI was we were kind of late coming to the party in terms of QAPI goes in the long-term care. Federal government developed the programs and the regulations associated with it, and then based on those guidelines or regulations, as providers, we are required to adopt, assemble, and submit that plan. And of course, that proposed rule became the final rule and was enacted into law. There's 5 elements. Of course, many times providers start at element 4. They gather maybe a little bit of information, but they decide, okay, we need to improve, so we're going to do a project. And they don't put a lot of credence into the first at least 2 elements, and certainly the third. And then they don't do necessarily a real good job on element 5, which in terms of systematic analysis is systemic action. So we're going to talk about these elements, and I want to focus a little bit more on design and scope and governance and leadership, because as an administrator, as a leader in your organization, you're going to be, you need to have a comfort level with all 5 of these elements, but certainly understanding the context of your role as it applies to elements 1 and 2. And so element 1, of course, again, is design and scope. And so your program has got to be all-encompassing. It can't be just focused on maybe just one area. Many times providers seem to immediately gravitate towards the clinical, and that's understandable. But the program is expected to be all-encompassing and not something that has got stops and starts to it. What the expectation is that this be something that is interwoven as part of your organizational culture. And so back to what I was saying earlier, this has got to be a change in your mindset. You've got to, it's just got to be a way of thinking. It's not something that you should be seeing as a compliance element. It's something that you should, weave into everything within your organization. And so, full range of services. It could be, food, it could be activities, it could be therapy, it could be maintenance, it could be business office. When it's fully implemented, the expectation is it should address all systems of care management practices and should, of course, as I said, include clinical care, but quality of life, resident choice, and there's, a multitude of other things. So comprehensive in nature. Again, it's expected that you're going to be keeping safety and high quality in mind. Again, within the realm of your customers, emphasizing autonomy and choice. And so many of you may be chuckling at this point saying, okay, with all of the stuff that CMS put out in terms of, locking down and, well, as I said, we're in a public health emergency, and sometimes a public health emergency will supersede some of that, and has. And as we try and slowly come out of all of this, we got to keep in mind, the intent of what QAPI is supposed to be doing, and that's encouraging autonomy and choice. We don't want to be just flying by the seat of our pants. We need to make sure that we have the best available evidence. And so understanding what is the proper standard that governs that, if there is one. And so you're going to be required, your facility already is, to have a written QAPI plan adhering to all of those principles. And I gotta tell you, I've seen a good number of QAPI plans. Can't say that I've seen maybe more than one or two that really, truly embrace this, both conceptually as well as literally. So still a lot of opportunity for improvement out there. And so element 2
I've got a
is the
question.
governing. Yes, sir.
Where, so what, excuse me, what's the common thing you're seeing in these plans that people are lacking? It's just not taking it seriously, or?
It's what I'm seeing is still more of an emphasis on compliance, where it's an exercise in compliance. We're not integrating that into our, we're meeting about it, but we're not. It still feels very stiff in terms of, we put it down on paper, but what I see on paper isn't necessarily what I see being lived out on a
Right.
daily basis.
I'm doing my internship now, and that's kind of what I'm seeing. They're just going through the motions and
Yeah,
to cover their documentations for surveyors.
yeah,
And that's
yeah. That's exactly what I'm seeing out there, and so we've got to make that jump from just looking at it as an exercise in compliance, understanding it is a compliance piece, but we've got to make it. We've got to shift our, as I said, our mindset. And
correct. Okay, thank you.
you're welcome. Good question. And so element 2 is the governing body. And depending on how you're set up as an organization, many of you may be working in a environment where you're a single site. Some of you may be working in a multi-level, a life plan community or CCRC. Yes, Tracy makes mention if something's been put in place and isn't working, you need to change it up. And that's that mindset of continuous improvement. And so if you have got an intervention that's being tried and you're not seeing the results that you thought you were going to see, then you've got to do something different. Problem is many times that compliance, mindset says, well, we tried it, It just didn't work. So it must be that we just can't improve. So depending on, as I said, depending on how you're set up, you may be the governing body. You may have a board. You may have a corporate infrastructure. And so anyone, depending on how your organization is set up, you may have individuals that you report to or that you're accountable to. And so you as the leader on a day-to-day basis on site, it's your responsibility to make sure that, for instance, if you have a board, that board is educated on what QAPI is and what we're trying to do as an organization. Yes, the governing board probably sets policy, but you're the operational, leader on site. And so helping them understand what it is that we're trying to accomplish, and then making sure that they are embracing and supportive of the things that are necessary and for you to move in that direction. And that includes adequate resources. And then obviously having somebody in place as kind of a champion. Now, I would caution that, I see so many different plans of corrections that basically say, at the end, we'll in-service staff, administrator DON to monitor. Okay, and I'm here to tell you that you need to share that a little bit more beyond just the DON or the ADON. Get other staff involved. Help, and of course, not just delegate versus dump, right? You need to make sure that they are properly equipped in order to assume that responsibility. But helping, having somebody else in that role as kind of a QAPI champion, not only helps spread the work out, so to speak, but it also does a tremendous amount of, has a positive impact on that individual and others that are participating, because they are seeing that what they do makes a difference. And it's more than just, okay, I come to work and I really don't understand the bigger picture here. This is an opportunity to help them understand, the inner workings, or that whole web of how everything is so interrelated, and helping them to contribute to that as a leader for this particular type of project. And so making sure that people are trained, that they've got adequate time in which to devote as needed, equipment, technical training, whatever is needed, that's part of that resources. Again, the governing body, whatever infrastructure you have in place. And this is where we talked about culture. QAPI, improvement in general has got to be a mindset and a priority. That, of course, from a more formal standpoint, that means that we should be reviewing, our policies, our procedures, to assure that, we can continue to try and improve, that there's nothing that's going to get in the way from us, doing what we need to do in order to continuously improve. And that's, asking those questions. Okay, what if, not what if really, when it comes to turnover, everybody has turnover, right? Evan Schulman from CMS was on a NACA webcast earlier, maybe it was earlier this week, talking about how staffing is a priority. Well, staffing should have always been a priority. This pandemic didn't cause our staffing issues. All it did was exacerbate them. And so understanding that, we certainly should be, that's part of one of our priorities. Okay, what kind of QI mindset are we going to take in terms of improving our ability to attract and retain quality staff? But while we're doing that, we have to have systems in place to assure that whatever we're doing has got to survive more than, the turnover of an individual or several individuals. We've got to have processes in place that will be, ingrained in our culture and not dependent on somebody being in place or not. And so, again, ensuring accountability, creating an atmosphere where staff are comfortable identifying and reporting quality problems, as well as ideas for improvement. This is taking the proverbial suggestion box to, about 3 levels above that. We should have an open dialogue with every one of our staff where they feel comfortable enough to say, hey, I've got an idea to do this better. And we should be encouraging them to be able to come forward with that. If they feel like they're being stifled, or if they feel like that there's going to be retribution for speaking up, then we're not anywhere near where we need to be from a culture standpoint. And your quality improvement program is not going to take off until you address that. Okay, so shifting gears a little bit in terms of your role as the administrator. And so one of the things that comes into play is your role as what I call a scout or a field general. Okay, as a leader, you've got to not only have an understanding of the inner workings, you don't have to be an expert. Not all of us are clinicians. Not all of us, we all have our areas of strength and areas that we're not quite as strong in. But as a leader, we have to be able to not just understand what's going on in our building, but we have to be able to look outside of our building and start looking out there on the horizon. Think of that scout being, from the cavalry, back in the early days of as the U.S. cavalry was expanding into the West. What's out there on the horizon? We need to be seeing, beyond just the tip of our nose. What's coming? What are we facing? And have understanding of where we need to go and how we know, is the best way to get there. And so when it comes to design and scope, we need to have an understanding of what our mission and vision is. How many of your organizations have a mission statement? And I'm talking more about not just that piece of paper that may be on their wall or on your letterhead. How many of your organizations actually have a mission that you can truly say, A, is memorable, and 2, is something that you can look at and then go out within your community and see is actually being lived? That's where we should aspire to go. If you don't have that, then you, in your role as a scout or field general, needs to help, facilitate a process to develop and or refine those things. What about your purpose statement? What is it that you are going to do that's going to lead you in the direction of your mission and vision? Action-oriented, very specific, so that you have a clear understanding of whether you're moving in that direction or not. What are your organization's values? What are those boundaries and parameters that you're going to reside within? When I was one of my first assignments as an administrator, we had a corporate mission. I was in a multi-facility organization, but we needed to have our own identity. Obviously, and that needed to tie into the more corporate umbrella. We didn't want to be in conflict with that. But at the facility level, we needed to have more of an identity. And so we developed our own complementary mission, vision, and values. And we utilized an acronym, and we called it RISE. We said, our values as an organization in this particular site, we're going to embrace respect, integrity, service, and excellence. And we took it one step farther. We said, okay, this is what respect means in this organization. This is what integrity means. And we spelled it out. We gave examples so that there was no question if, for any one of our partners within the organization, everyone understood what respect, integrity, service, and excellence means. And then what we did is we took it one step beyond that, and we wove that into our policies, procedures, and the like. So both formally and informally. So from a design and scope perspective, having a mission, vision, and values, and understanding that you've got actions associated with fulfilling your purpose will help you move in a more clear direction of continuous improvement. We have to view our organization as a system, as I said, understand what our mandates are. What are those environments, both external and internal? What are the strategic issues that are facing us as an organization? Okay, and so, let's just put it in context of what we're facing right now. What are, we've got mandates associated with, infection control. We've got the all of these various reporting requirements that come into play associated with COVID. We've got the point of care testing and making sure that we've got, our CLIA certificates updated. It's funny because all of these years, we've all, kind of, the CLIA, the only thing that came into the play was, maybe the blood draws. Well, now you don't get the point of care testing unless you have your CLIA certificate updated. And I've had numerous clients that their CLIA certificate was still in the name of a entity that was long gone. They had change of ownership or change name or whatever. And so some of them were wondering why they didn't get their point of care test. And so they had to make those changes in order to take advantage of it. The external and the internal environments. And so, externally, we've got all of this guidance. Many of you may be struggling right now with trying to understand all of the elements associated with payroll protection, PPP, as well as the CARES Act funds, all the various dollars that are coming our way, and how do we properly account for all that. It's a circus out there right now when it comes to trying understanding externally. Internally, obviously, the staffing issues, the infection control, dealing with the role that you play within your greater community, and dealing with families. Having understanding of all those environments, and then using those, that learning to help build a system of improvement, incorporating the other elements, the performance improvement plan, systematic analysis, and the data collection. How many of your organizations have a strategic plan? And I don't encounter many that actually do. If you're a not-for-profit, you may have a higher likelihood that you've got a strategic plan, but even in that regard, I would question how many of you are truly carrying that out. Again, is that an exercise in compliance, or is it an exercise to allow the board to feel like they're contributing in some capacity? Strategic plan has to be something that is operational and implementable on a daily basis. Stephen F. Covey, who wrote 7 Habits of Highly Effective People, was incorporated basically a mindset or a phrase that he incorporated in there. Says, begin with the end in mind. So have a clear understanding of where you want to end up. As I said, recognizing, your mindset of QI is not that you're actually ever going to get there, but you have this clear vision of where you want to go. And so that's where you begin. And then you work your way back in terms of the interventions or the systems that are going to move you in that direction. You've got to have enough flexibility to allow for changes in course. How many of us in January thought that we would be dealing or in the position that we're in here in October at that point? I would I have no hesitation in saying that none of us had any idea that we would be dealing with what we've been dealing with during 2020. We've got to allow for changes in course. And if that's one learning that comes out, if that's one silver lining that comes out of this crappy year that we've had, is we've got to have enough flexibility to pivot. Clint Mon, some of you may have heard of him. He's a kind of a management guru out there. I've known Clint since, back to 1990. Anyway, one of the things Clint is, I remember him saying, is that errors only become mistakes if you fail to learn from them. And so we have to understand that we're going to make mistakes. We have to encourage our team to, not be risk averse. I mean, obviously, there are certain things that we don't want to mess with, especially when it comes to health or human life. But we can't be afraid to venture out and to take steps out beyond our comfort zones. And so, yeah, we're going to make errors, but if we don't learn from them, then that's only when they become mistakes. Okay, so in our role as a change agent, as an administrator, okay, and so we're in element 2 in terms of governance and leadership. We have to understand, and as a change agent, be able to describe how we're going to incorporate or integrate QAPI into our overall organization. That includes, depending on your infrastructure, your regional level, your board, your owner, whomever, and help them understand how QAPI needs to be resourced, managed, measured, and reported. Many times boards, don't have a clear understanding about that. Certainly, putting your own stamp on something, if you're in a corporate environment, corporate is going to likely come out with, specific guidance and direction. There's nothing that says you can't put your own stamp on that, though. Make it yours, own it as an organization in your own greater community. How do you do that? Well, you establish a sense of urgency. There's a book called Leading Change by John Kotter, Kotter. And in this book, Kotter talks about establishing a sense of urgency. And it's not, running around your organization with your hair on fire, but it's basically fighting complacency with, we're not going to get where we want to go if we're sitting on our laurels. Okay, and so that sense of urgency has to be there. We've got to have a drive. That fire's got to be lit, just not your hair on fire. Okay. Additionally, we're going to talk a little bit more about this specific book as we move into a different section this afternoon. But one of the most impactful books that I've ever read in my career, that's had an impact on my career, has been The Leadership Challenge by Kouzes and Posner. And there are some aspects of leadership that make you more efficient and effective. One is, inspiring a shared vision. We talked about mission, vision, values a moment ago. And so having a shared vision, inspiring that within your team, a guiding coalition is going to be what we would call those early adopters, those individuals that are, willing and able to get on board very, very quickly. And so that becomes a guiding coalition, and it helps you to spread the message about what that vision should be, and being willing to, of course, evolve that as you get more feedback from the greater group. You've got to communicate effectively. It's something that you should be, that shared vision should be something that is on the tip of your tongue as you're talking with staff, both informally and formally. You got to put people in a position to be able to act. And so fostering collaboration, finding ways to strengthen others so that they feel like they're empowered, that they are, not going to get stepped on because they went out and tried to do something a little different. Modeling the way. Modeling the way means setting the example, walking the talk. You've got to, recognize that as the leader, whatever you say is, you've got to not only you got to believe it, but you've got to live it. Finding ways to generate some short-term wins. I mean, certainly keeping your eye on the ball in terms of where you ultimately want to end up. But as I said, begin with the end in mind, work your way back, and have some little milestones that you can use to say, hey, we're making progress. And so having a measurement system to allow you to say, we were there and now we're here. That's good news. We're going in the right direction. Let's keep it up. Consolidating those gains that you've made, and then continuing to equip your staff so that you can make additional change as needed. And you can't do that without, of course, encouraging the heart, and that's recognition. So many organizations don't do a good enough job at recognizing both individual and team contributions and celebrating those accomplishments. And it doesn't have to be this big blowout party. Hey, we did it. Well, we had no turnover for this month. Well, that certainly is indicative of celebration, but make sure that the celebration is in proper alignment with the level of the improvement. So how governance and leadership is important to QAPI? Well, you got to have the buy-in. If everyone within the organization, up and down the food chain, if they don't have a buy-in to continuous improvement, both in terms of resources and mindset, you're not going to get where you need to go. And only governance and leadership can help allow for that environment to foster a mindset of quality improvement. And you as an administrator are representative of that governance and leadership. There's a lot of information out there about QAPI. I won't read all this out there, but CMS has had a QAPI site. The trade associations obviously have information on QAPI. You can YouTube. I mean, there's so many different avenues to get more information about QAPI. In long-term care context, operationally, obviously you can utilize quality improvement when it comes to any of your satisfaction data, census development, marketing, certainly financial areas in terms of accounts receivable, budget, and the like, understanding where you're at. I mean, like I said earlier, there's nothing within your organization that you can't utilize QI principles to improve. And so the role that you play, as I said, you can become a scout, a change agent, be a coach, but you've also got to be a reconciler, understanding how do you reconcile where you are versus where you want to be. Maybe you're not on the right, maybe not moving as fast as you would like. Well, you've got to reconcile, is that reasonable to expect. Maybe you need to change your expectations. And then being a nurturer of team and individuals, helping them to, continue to be encouraged. I mean, they're not going to always get it right the first time. And so instead of browbeating them, being that, supporter, that coach, that cheerleader to help them understand that, okay, you didn't get it right this time, but hey, let's try it again. And then being the community voice, being out there in whatever role that you're playing out in the community. In your capacity as representative of your organization, be willing to be a voice out in the community. The media is not going to immediately default to, hey, look at all the positive stuff going on at, this facility. You've got to be out there, shouting to the heavens about how, things are moving in the right direction and how, the achievements that you all are achieving. A lot of tools out there, MDS, your survey, deficiency statements, your QI, QM reports. I mean, there's data. There's all kinds of data that you can pull from. It's there. It's just how do you go about using it in a strategic way? We've always had the information. It's, how do we make sense of it and how do we use it in a way that is in context with our ability to improve? As I said earlier, benchmark against your own performance as well as, established peers. Nursing home compare is a good place to look for maybe how others are doing in specific areas within your community. If you're the only show in town, congratulations, you're the exception. Most of us have competition out there. So we should always have keep an eye on how they're doing as well. Not to say that, you should devote a lot of time to that, but it helps you to validate your improvement efforts compared to how others are doing. And then reporting and communication of progress. As I said, being a voice within your community, both internally and externally. Keeping the message front and center to staff, to your families, to your residents, to your docs and to the community at large. Docs, your referral sources, helping them understand the progress that you all are making or how well you're doing. Your medical director should be a champion for you out in the community, but they need to be properly educated and they have to understand some of the data as it relates to how you're performing. As I said, W. Edwards Deming, changes needed now and quality relate to how people are managed and motivated. More people must take pride in their work. And how do they do that? Well, some of that comes from within, but a lot of it has to do with the culture that you as the leader help perpetuate. And so as a leader, you got to look at how ultimately you want your organization's culture to look, and then set about going to putting that in place so that everyone feels like they are able to take pride in their work because they feel like they're making a difference. A few references, as I said, there's the Covey, John Cotter, and the Kouzes and Posner. As I said, we'll be talking a little bit more about the Leadership Challenge in a different section today. Any questions? Questions or comments? Y'all still awake?
We're awake.
Yep,
Good.
we're here.
Okay. Very good. Okay, so, all right. All right, well, we are at a point. Z, I don't know if you're on, but we can take a short break.
I am here. Okay. You getting ready to start a presentation then?
I'm sorry?
You'll start your other presentation after this one?
Yes. Yeah, we'll move into Medicare.